All right, welcome everyone. Thank you so much for joining us tonight, Monday night, starting off the week great, learning some new stuff. I do have everyone on mute for now, so if you have any questions, feel free to unmute or use the chat. And we'll be here. I'll be monitoring the chat if you write anything in there, and I can let Sam know whenever I have time.
Yeah,
I'm going to turn
just
it over
interrupt
to
me.
Okay.
You can totally just interrupt me if there's something in the chat that I'm missing. Sometimes when I'm sharing my screen, I can't see what the wonderful things are that are happening in the chat. So I'm so thankful to be with you all on this Monday evening. I hope you all have been staying cool in this hot weather we've been having. Today's been much better, but I know that's been a struggle to get outside with all that heat happening. So I'm Dr. Sam Cotton, and I work at the University of Louisville Traeger Institute. One of my primary focuses in both my practice and my research is working with persons with Alzheimer's disease and other forms of dementia. And this passion comes from a very personal place for me, like it does, I'm sure, for most individuals who do the type of work that I do, in that I've had many family members who have dealt with this particular disease. My first exposure to Alzheimer's disease was actually when I was about 7 years old. This was like the late 80s, early 90s. My grandmother was actually diagnosed with Alzheimer's disease. And I watched as my mother, as her caregiver, really struggled in terms of dealing with some of the behaviors that she had as part of the disease. Things like being very aggressive, sometimes when she was no longer able to communicate with what was going on with her. So again, this all comes from a very personal experience as well for me. And in my adult life, having been a caregiver for some of my family members who were struggling with the disease as well, and seeing how that caregiving experience can be very difficult and challenging. Even though we're getting to spend that wonderful time with our loved ones, sometimes there are challenges that come up. And so today in this training, we're going to be talking a little bit about the basics of Alzheimer's disease. We're going to talk about some of those behaviors. I've picked a couple that I commonly hear from folks that they're the biggest struggle that we'll talk about. And then we'll talk about compassionate caregiving and what that looks like as well. So again, at any time, I want to make sure that if you have questions, you can put those in the chat, or if you have or if you have availability to unmute yourself, feel free to do that as well. We're here to help and support during this particular time that you're going through. So I just want to start with a couple of key points about Alzheimer's disease. And first, let me step back and say that sometimes when we're talking about Alzheimer's disease and dementia, sometimes we use those words interchangeably. And really, I want us to make sure that when we talk about all dementias in general, that's really an umbrella term. And Alzheimer's is one type of dementia. Now, a lot of times we do hear that interchangeably because based on what we know about prevalence rates of this particular condition at the moment, around 60 to 80% of dementia, different types of dementia, are Alzheimer's type dementia. So that's why you might often, if you're reading something in the news, or if you're hearing your primary care provider who's working with your loved one, use those words interchangeably, that's often why. It is a progressive disease. We commonly talk more about the memory piece. However, it doesn't just impact memory in terms of your whole brain health and that focus on what's going on when you have Alzheimer's disease. It can also impact your ability to conceptualize and process information. So sometimes we see individuals' communication is impaired following conversations. Even things like being able to express pain, if the individual is struggling with that, can often be difficult as well. And because of that, it really impacts us as caregivers and that caregiving experience, right? Because we can't always maybe understand what our loved one needs in these situations. So it does make that sometimes difficult on us. We often talk about Alzheimer's disease in the United States as impacting or having had 5.5 million individuals who've been diagnosed with it. But I will tell you that as being a caregiver, having been a caregiver, having worked with caregivers, in my experience, we know that that impact is actually much larger than just the individuals who have been diagnosed with this particular condition. It can really impact their families, their friends, their communities. Again, when we talk about 5.5 million people are living with this particular condition, again, I like to say it's much larger than that just because of the impact that it can have. And in general, we know that there's currently no one medication that prevents or cures Alzheimer's disease. And so we know that this is going to continue to be a challenge that we need to address moving forward. And I will tell you that the way we talk about Alzheimer's disease in general has really impacted the caregiving experience as well. We often talk about it in very negative terms, right? Which makes it this very scary disease. We call it the thief in the night. We talk about it as being a disease of old age. We talk about it how it robs the individual of their ability to do, this, that, and the other, be able to do those activities of daily living, like getting dressed, being able to eat independently sometimes. And so all of these phrases really take away that hope piece. And so what I like to do when I talk about Alzheimer's disease is focus more on that hope and focus more on the compassionate caregiving piece, and how we can really integrate that into our day-to-day, and really spend that time with our loved ones, making that meaning with them, regardless of the situation that we find ourselves in. And just in brief, because I want us to all have this frame of reference, and I'm not going to go too much into detail about this. If you're ever more curious about this piece or want more of a breakdown of what you've been told when your loved one was diagnosed with Alzheimer's disease to better understand some of the things that are going on with them and some of those changes that you might be seeing, I'm more than happy to do that. Either come back for a different training and focus in on that piece, or even if you need a one-on-one just to ask your questions about some of the different hallmark things that we see. But typically we know within the brain of persons with Alzheimer's disease, there's the abundance of two abnormal structures. And we know that this causes really that miscommunication within the brain. So even simple things like touch, smell, and even taste sometimes are impacted because of this. Obviously, we know that it impacts memory because individuals are no longer able to remember certain things, either things from a really long time ago or things that are more recent. And so, understanding that piece of the puzzle can be, I think, impactful for us as caregivers because it helps us better be able to respond in the situation. But again, I'm not going to go into too much detail on this particular piece because of the fact that we want to focus more on the caregiving experience. I always like to highlight too, there's so many different theories about what causes this. If you've read the news, you've probably seen, studies about, different things like coffee being a protective factor for your brain health, or a number of different supplements on the market being protective for brain health, and some of the different things that can cause Alzheimer's disease and other forms of dementia. And what I want us to think about it more in terms of the simple factor is that for Alzheimer's disease and persons living with this particular condition, it's sort of like a Rubik's Cube in terms of figuring out what works for that individual. I always say if you know a person with Alzheimer's disease, you know one person with Alzheimer's disease, because it really does impact people in different ways. And for some individuals, things that we see that they struggle with in the beginning that cause them to get that diagnosis of a type of dementia like Alzheimer's disease might not be as so apparent towards the end of their life. So the trajectory of the disease looks very different for individuals. Some individuals we see have challenges in terms of certain behaviors. I always hear the stories about people saying, "Oh, my mom never cursed. I never heard her say a bad word in her entire life, and now suddenly it's just, she's using all these curse words." And so it's different people are impacted different ways, right? And so we see that that can be a challenge for caregivers through that experience because they are different than they were before they had the disease. And so seeing our loved one in that way can be very challenging for us. And I would say too, I always do this as a cautionary tale. There's so much in the news about different studies related to brain health and related to Alzheimer's disease. And, we're starting to focus more on lifestyle changes and focusing more on that particular piece of working with individuals with this condition, even from once they're diagnosed, focusing it on how can we help in terms of, minimizing things like inflammation, for example, that can help them just feel better, even if they're already struggling with this particular disease. And again, we talk a lot about many possible causes, many possible solutions, but in terms of the caregiving experience, really taking it back a notch and talking more about that compassionate care piece. And that's what the remainder of our time today that we're going to be focused on. So I've tried to design this so that at the end of our training, we'll have time for questions. So if you're dealing with something in particular with your loved one that maybe I don't cover in certain terms, or you want to throw out a scenario that you're dealing with, that we can talk about how you can respond compassionately to that, we'll have time for that as well. So when we talk about compassionate care, a lot of times when we're as caregivers of persons with dementia, we really have to do a lot of focused, basic nursing care, right? Helping the individual take a bath, helping them get dressed. Sometimes we're helping feed them. Sometimes maybe we're not doing full hands-on care yet, but we're having to remind the person, oh, now it's time for a seat lunch. Now it's time for you to get dressed. This is not an appropriate outfit because of the weather, things like that. So we get focused on that particular piece. And sometimes with our loved ones, it's very difficult to take a step back and have that meaningful moment with them where you're sharing this experience. And that's where compassionate care comes in. It's really recognizing the suffering that your loved one's going through and trying to think of ways to provide care to alleviate that suffering that they're dealing with. A lot of times, as I mentioned earlier, and you probably have witnessed this in your caregiving roles, our loved ones can't always express to us what's going on with them. So sometimes that manifests wherein you're seeing a behavior or seeing them act in a certain way that you're not accustomed to, and maybe you don't know how to necessarily deal with that in the moment. And so that's where compassionate care comes in. It's about finding the why behind those behaviors and figuring out how do we address that piece. And two things that I commonly get in terms of and I've in my personal life have had challenges with loved ones as well with these two areas. So I'm going to start here just to show you how compassionate care and really thinking about the why behind behaviors can be helpful. So the first two examples I'm going to use is refusing to shower and getting agitated at meal times. So when we think about the refusing to shower piece, a lot of times with basic care that we need to provide to our loved one, we might focus in on making that person shower every day, even though it's such a laborious chore for us to get through. That person might be very agitated. They might be very upset during that particular situation. Same goes with meal times. If you're in a larger family situation, so maybe you all get together one day of the week, for example, and have Sunday meals together, and your loved one is really getting agitated every time you do that. It's sometimes time to take a step back and say, okay, what's really causing this particular behavior? And sometimes we don't always know immediately, right? We have to kind of think it through and see what and observe a little bit. So when I want to focus first on the showering piece and how we could handle that in terms of that compassion piece. So we want to come up with a plan so that our loved one is clean, related to their hygiene. We might want to focus on, do they really need daily full-on showers, right? Maybe sponge baths on those days that, that's just not going to happen because they're too agitated by the situation. The other thing I want to highlight too about showers in particular, and why those can sometimes be so difficult for individuals, is because when you have Alzheimer's disease and other forms of dementia, sometimes you have this heightened sense of touch. And sometimes things like the water running from the shower head to the basin of the tub, that makes a really loud noise that many of us we don't really think about it. It sounds soothing to us, right, to run the shower. But for a person with Alzheimer's disease, that can be very overwhelming to them. And actually the water hitting their skin can make them, it can feel painful to them. It doesn't feel soothing. It also can be a very confusing, overwhelming situation. They're having to get undressed, they're having to step into the tub, they're having to turn on the shower, they're having to, figure out what's the order of operation here, washing the hair, washing the body, what does that look like? And so because that's overwhelming and they're not able to tell you, this doesn't feel good and I'm overwhelmed by this, sometimes what we see is people become agitated or aggressive. So you might see them, throwing things or, spitting or kicking, because they don't know how to express that in any other way. So that's how that particular behavior manifests for them. So what I suggest as well is try to make the showering situation as relaxing as possible. Think about using aromatherapy. Smell can really help individuals calm down in certain situations. So that's something to think about. You can also think about soothing sounds, and putting, if you have an Alexa device or any type of music device that you can put in the bathroom while you're trying to do the shower bath time, that can be helpful as well, and really help in terms of just that overall experience if that person's, being aggressive or agitated. In general, they might also, instead of being aggressive or agitated, just say, no, I'm not doing that, right? So you have to figure out ways to make it more appealing to them sometimes. I worked with an individual who had Alzheimer's disease many years ago, and one of my roles was to help her with personal care, and she hated to shower. She didn't get really agitated or aggressive during that time period, but she just would flat out refuse to do it, and she was very difficult to engage when it was time for her to take a shower. And so what we figured out as a team, the people who were providing care to her, was that she liked singing. And so even just humming and singing a song while going through that routine that she didn't like made it more engaging for her. And so she was able to actually take a shower on a more regular basis because of that. And it wasn't so anxiety inducing for her and for the caregivers for who were working with her. So simple things like that can really help in terms of that whole compassionate care piece. Same goes for agitation at meal times. We see this sometimes in restaurants where the music's really loud, the lights are really dim. Individuals can become overwhelmed by that who have Alzheimer's disease. There might be too many people having conversations around the table. We also see this a lot of times in our nursing facilities as well. So if you're doing any type of long distance caregiving and maybe your loved one's living in a nursing facility, sometimes those congregate meals can be very difficult for individuals because it's just too overwhelming. So some things to look at if your loved one is getting agitated at those types of settings, but not just meals in general. So if it's just the two of you eating dinner and they're fine, it's probably that either it's too overwhelming and they can't respond to all the stimuli that are being thrown at them in that moment like we can. Maybe the setting's too loud, maybe it's too dark, maybe it's too hot. And so that's why they're reacting in the way that they are. So maybe thinking about how do we keep them social but also, have them enjoy those mealtime experiences. And so what I would recommend, if you're trying to do a big family meal and that's just not working, maybe it's a holiday or something like that, if it's possible for you to set up two, sets of tables for people and have a smaller group set with that loved one, that might even be helpful, because I know holidays can also be problematic in those situations as well. And I know that when we talk about compassionate care too, and this kind of goes back to the showering example, right? Because we do want our loved ones to, feel clean, to, have dignity and all of that in their appearance. But sometimes as a caregiver, we really prioritize our values and preferences and the caregiving experience. And it's those things like the hygiene piece, health, their health and them taking their medications, their overall safety. We want to provide the best care possible, but sometimes that's in direct opposition with what our loved one wants, right? They might be more focused on some of these other areas of their life if they're still able to do those and find joy in them. And so they might prioritize that. We often see this a lot of times in the early stages of the disease as well, where when we're providing care, we might be overly sensitive to some of these needs that the individual needs help with, and not necessarily paying attention to some of those things that bring joy to them. So when we talk about compassionate care, we're really trying to get more of a balance between what we want as caregivers, and to provide the best care possible, and what our loved ones want. And so sometimes that balance, it's difficult, right? Especially if it's something where you feel like, oh, this is not going to be safe for the individual, right? Trying to figure out what that looks like and put parameters around it so that we can help that individual still do some of those things that bring them joy, and not just prioritize those things as caregivers that we see that are needed. So those were just some examples to start us off in terms of our conversation about compassionate care. But I'm going to focus on a couple of things now that I've seen quite a bit in my experience, both personal and professional, in terms of working with persons with different types of dementia. And the first thing that I see a lot is repetitive thoughts and behaviors. And I worked in a residential community for about 4 years. And one of the residents that I worked with had Parkinsonian type dementia. And before she had moved into our facility, she'd been living with her adult brother, and she was probably in her 50s at this point, maybe early 60s. And she also had an intellectual disability. And she loved lunch. She loved talking about lunch. She would ask the same question over and over again. She would say, "What's for lunch?" Literally from the moment she woke up till 5, 6 o'clock in the evening, all the way up to even bedtime. And she'd wake up the next morning and start asking, "What's for lunch?" again. And answering the question did not appease her. So you could say, "Oh, we're having a ham sandwich on rye bread today for lunch." And so that didn't fulfill that need. So she would keep asking the question. And from the caregiver perspective, yes, it was a simple question. It was very benign, but it was very frustrating. And so I'm sure that some of you have been in this situation before in caregiving where you're getting the same question over and over again, right? And sometimes redirection is difficult in those situations. In our situation, it was also dominating staff time because she wanted you to be right there with her when she was asking the question. And there were other individuals living in this particular community that we were providing care to. And so all the staff who were working with her were very frustrated. And so we had to take a step back and figure out, okay, well, why is this what she's focused on? Like, why is this so important to her? And we learned after, and her brother had not thought to tell us this because he didn't see it as it. I think the repetition had gotten worse when she moved into this particular setting, but she lived with her mother most of her adult life, and they were ladies who lunched. They went out to lunch almost every day, and it was their special time together to spend and really just talk and look at all the people around them in the restaurant and have fun and gossip and all of that. And her mother had passed away several years, like I mentioned before. And once we realized that this was her way of saying sort of, "I miss my mom," without knowing how to say that, we were able to turn it into something more special with her. So what we did was we worked with our team to come up with a plan where she helped plan the lunch Monday through Friday in her house. And then she would call our other properties and invite other residents to come over for lunch. She would always have a plan for what they were going to talk about. Because she had Parkinsonian dementia, she was obviously had some issues with memory and communication. But this really helped fulfill that need of being social and having that meaningful time with people and being able to engage in this way. That we did see a decrease in her repetition. And actually we saw her really flourish in this particular setting. She felt like she belonged. She felt like she contributed to the, what was happening in her community. So if you have a loved one who's doing something similar and it's something that you can turn into an action, let's explore that. What does that look like? And it doesn't have to be elaborate. I mean, we weren't making like, gourmet meals for lunch every day, but it was something that she could help and participate in and then engage with people in a way that was meaningful for her. So sometimes it's just thinking outside the box and figuring out, okay, how do we make this work in this particular situation? If you're getting, and these are tough, right? Sometimes you're getting not just the easy what's for lunch, right? It's a little bit more deep and complex than that. Sometimes you might be getting repetitive questions about loved ones, people who died 40, 50 years ago, right? And, you want to focus more on that emotion piece. They might be, in this particular situation, the resident I was working with missed their loved one, right? Missed that they had an absence there. Your loved one might be missing somebody that you maybe never met, right? Because they passed away when you were young or before you were born. And so, don't necessarily focus on that person's dead. Try to turn it into a conversation about, that maybe a story about that person that they can share with you. Don't focus either on is this accurate or not, as it relates to the story. Just let them share and focus in on that emotion piece. I had an aunt who had passed away in 2015 with Alzheimer's disease, and her mother, my great aunt, had passed away maybe 10 years before this. And so sometimes she would ask where her mother was. And, instead of us saying, oh, well, she passed away 10 years ago, we would focus more on, oh, tell me about that time you all went to Wyoming on a vacation, and let her share. Now, did she get I knew a lot of those stories, right? Did she get all the facts straight about what happened on the trip? No, but we didn't worry about that. It was allowing her that time to share. And reminisce about that person that she loved and she was obviously missing. The other thing I would say too is that sometimes we see repetitive movements in individuals that are difficult. So things like rubbing walls or rubbing tables, things like that. Pacing. Sometimes we see pacing. Sometimes we need to turn that behavior into an activity, right? Especially if you're concerned about maybe falls hazards or falls risk. If you have pets in the home and you're worried if the person's pacing, the dog or kitten is going to get underneath their feet and cause them to fall. And so you need to focus more on, what can we do about this situation? I would focus in on what are these things that person can sit and do to get out some of that energy, because sometimes when it's a repetitive movement, they don't know how to express that maybe they're bored or that there's something else going on and they need to get that energy out. So giving them something to do. I've worked with people where, they would fold laundry. They would just sit and fold laundry because they liked that it was the repetition was comforting to them, right? And so then the caregiver would take the basket back in the bedroom, dump it, unfold it, bring it back to them, let them sit and fold it again. So even simple things like that can be very soothing for the person if they need something to do. In a little bit, I'm going to talk about reminiscence therapy a little bit more detail. And there are some other tools that can help people who have that fidgeting going on as well. So hang tight for that. And then sometimes, if the behavior isn't harmful, let's figure out how do we accept this? Now, if it's the same question over and over again and you're getting frustrated from the caregiving experience, then I think it's really important to, let's figure out how do we turn that into something, because it can, we got to have compassion for ourselves too sometimes in these situations. um, we need to take time to focus on the why. So sometimes that can help, focus on the emotion, not the behavior. And I think a lot of times we want to ignore the question because it's sometimes difficult for us to answer. But if it's a repetitive question, provide an answer and be patient and understand that you might not have the right response. Right, you might be taking the conversation in a totally different direction, but that's okay. If you're able to redirect the person in that moment and that works for them, I say go with it in those situations. And so compassion is us trying to find the patience in some of those repetitive moments that we're dealing with our loved ones. And when I think about that as well, I want to also highlight, having compassion for yourselves as caregivers is really, really important. A lot of times engaging in things like self-care can be really helpful in terms of just recharging your batteries, so to speak, so that you're able to engage in some of these more difficult aspects of the caregiving experience. The next thing I want to focus in on is anger and agitation, because this one can be very difficult in terms of if we're seeing this and maybe we've never experienced this with our loved one before, and they're really struggling in terms of not being able to communicate, and so it's coming out in this way, right? And it can be scary, right, for us as caregivers when that happens, especially if we don't know how to respond. So a lot of times what we see is that, we really need to kind of isolate the situation, especially if it's happening over and over again. And you can see some commonalities between the situation. So we have our person with Alzheimer's disease that we're providing care with that we love. We have the situation. So whenever they're getting agitated, and we might see a bunch of different behaviors come out of this. They might be screaming, spitting, kicking, throwing things. They might be saying things that are really hurtful to us in that moment. And so trying to figure out the situation piece, what contributed to this, right? Because there's a multitude of things that can cause those situations. I'll give you an example, and I'll never forget this, even though I was only 7 years old. This is one of those things that's like imprinted in my brain at the moment. But when I guess maybe I wasn't quite 7 yet when my grandmother was first diagnosed with Alzheimer's disease. But at some point during her journey, she ended up going to the hospital. And I don't remember the exact cause of why she ended up in the hospital. But it was in the emergency department. So it's loud, it's confusing. She doesn't know where she's at. She had broken her hip at this point, and even though they did surgery, she was never able to walk again. So she wasn't mobile, but she was still very strong. And she was spitting and tossing her hands, and no one could get close to her to do the examination that they needed to do. And again, I don't remember exactly why we had to take her to the emergency room, but they were trying to sedate her so that they could deal with all of whatever was going on with her. And she was so strong that when the doctor went to give her the injection of the medication to sedate her, she grabbed it out of his hand and took it and stabbed him in the shoulder-ish area. So, dealing with all of that, instead of trying to first calm her down and have that, trying to figure out how do we soothe her in this moment, the situation got much worse. And so, again, people have different reactions to different stimuli. So trying to figure out what's the situation that's causing this. And again, sometimes you might have to, the other people who are part of this caregiving experience with you, your other loved ones kind of talk about this and see what's actually causing this issue. So I'm going to give you the example of Jimmy, and Jimmy has these issues around showering. And so, screaming loudly, hitting his caregiver, he's throwing the soap. He hates the showering experience. And it's not I don't want to do this. It's this is what's happening every time. So we have to step back and say, okay, what's causing this anger and agitation? Sometimes it's a physical response to things like pain. So for example, I mentioned earlier, sometimes persons with Alzheimer's disease and other forms of dementia, it's painful for them when the water hits them in the shower. So it's a physical response. Maybe they're in pain. If you're seeing this with a person that you're taking care of and you've never had this experience with them before, and it seems completely out of left field, so to speak, you might want to think about, are they in pain? Have they fallen recently? Maybe you didn't think it was, anything happened when they fell. It seemed they got right back up, but maybe there's something else going on. Maybe they have a deep bruise or they've broken something. So look for things like pain. Sometimes we also see in women, UTIs can cause this type of physical response as well, where they're agitated or aggressive suddenly out of nowhere. And so that pain, they're not able to say, I don't feel good. And so that's how this comes out, is that anger and aggression piece. You have to remember that our loved ones cannot always communicate to us our feelings. So we have to really focus in on observing what happened up until this point with them. For some, it's going to be that they're stressed or tired. Sometimes our loved ones are going to feed off of our emotions. So if we're stressed or we're tired or we're irritable because of this caregiving experience, they might be able to pick up on that. And so they're mirroring what they see, right? Because they don't know how else to communicate. And so, it's really important for us to stay calm in those situations as well. Sometimes it's just not understanding the situation, not tracking the conversation and getting that frustration of not being able to follow the conversation. And I want to say too that I know I've highlighted some of this, but communicating sometimes, especially the shower piece with the anger and agitation piece, going back to that, communicating, what are those steps can be really impactful. And this goes for any other task that might be just challenging for your loved one. So even maybe they're getting dressed in the morning is a challenge and they get really aggressive during that time. Taking a very small approach to getting dressed even can be helpful. So, okay, we're going to start with our shirt. If the shirt has buttons on it, we're going to button the first button. Now we're going to button the second button. Now we're going to button the third button, so on and so forth. Walking them through that, because they don't necessarily remember that this is the order of operations. This is how this is supposed to work when I get up in the morning. So, really making sure that those steps that are involved, you say them, and you might have to repeat them over and over again. You might have to do this every day related to that. But sometimes that when we go to the thought that it could be them not understanding the situation piece, that can make a difference. And again, it's those small things that can be helpful. Again, the physical discomfort thing too, outside of the pain piece, it can also be, are they hungry? Are they thirsty? Are they too hot? Are they too cold? Sometimes we see that individuals get either they get more cold, or they're more sensitive to the cold, or even just sitting near a fan and that blowing on them can cause them that physical discomfort, or the opposite with being too hot and we don't realize that they've gotten too hot. Medications, if you're noticing this a sudden thing with an individual, a lot of times the medication piece can be an involvement there, and you're going to want to talk to your primary care provider about that piece if you're noticing these changes shortly after a medication change has happened. I always tell caregivers that, those first few days when somebody starts something new, or maybe they've changed something, or even if it's not a new medication, if they've upped a dose or lowered a dose, pay attention. Are you noticing some changes in your loved one? Because that could be clues that, maybe they're not adjusting to that medication as they should. And maybe there needs to be some other involvement with the primary care provider that you need to reach out. So those are all things to think about as well. And let me go to, hold on just real quick here. When you're in this situation with your loved one and you're really struggling related to them being aggressive or agitated, or they're, even swatting at you or something like that, or hitting at you, focus on de-escalating the situation, right? And in the moment, we might feel hurt by that, right? Because we're doing so much for our loved ones. And so thinking about, let's focus on this situation and understand that a lot of times their agitation or their aggression that they are displaying towards you in this moment, that's a byproduct of the disease and the fact that they can't communicate what's going on with them. And so thinking about removing them from the situation can be helpful. Even if you just have them walk with you to a different room, it's something about that sometimes can just, bring down that aggression that person's experiencing. Even just if possible, and it's safe to do so, putting your arm on their shoulder and rubbing it. Being very in the moment with them and focusing on that emotion with them can be helpful. And I often too think about in these situations, if you're really trying to remove the person from what they're focused in on or what's causing this aggression, doing something that redirects their attention to something more pleasant, like playing music, or maybe turning on a familiar TV show for them, or something that you normally see them finding comfort in, can be helpful as well. So sometimes it's moving them from that situation that can make all the difference and reset. And in 10 minutes from now, they might not even necessarily remember that happened, or that they were agitated about that particular piece. But it's all about, thinking about the safety piece, thinking about, really de-escalating that situation and focusing on it from that standpoint. Again, just to reiterate, I know it can be frustrating. I know it can be really tough in those moments to deal with some of that. So making sure that after you've de-escalated the situation with your loved one, that you take a deep breath and find something in terms of your self-care that's important to you, whether that be, taking a walk or cooking your favorite meal, or whatever that looks like for you, taking a bath, whatever that looks like for you, focusing in on that so you can recharge, because again, these are the situations that sometimes are the most stressful for us. I would say too, in terms of this particular piece, really trying to figure out the immediate cause of the situation, so you can remove that stimuli from the situation, redirecting them. I think I already said this, but the remain calm, don't get upset piece. And sometimes I mentioned playing music and stuff like that, but whatever is relaxing for your loved one in that moment, right, is one of the most important things that you can do. For some people, even just pulling out if you have a photo book, a memory book with pictures that you can just pull out and start looking at together when they're agitated, can make the world of difference. So again, it's these small things that we can do in terms of our day-to-day that can be the most impactful in terms of the care piece. And speaking of the memory book, this brings me to using reminiscence therapy. And if you've never heard of reminiscence therapy, I know it's got the word therapy in it, so you're thinking, oh, I can't do that, I'm not a therapist. Not true. Anybody can use this. It's a really great tool for you to have in your toolkit as a caregiver. And really, it focuses on, engaging persons with Alzheimer's disease and other forms of dementia. It focuses on creating that bond between the caregiver and your loved one, because you're reminiscing about things in a way that's, it has some parameters around it, so that you can feel like you can guide the conversation if needed. And it can help manage some of these behaviors. So I mentioned earlier, if your loved one's getting agitated, and you need to redirect them to something, even having, a photo album where you're going through and looking at pictures from past vacations or trips, or even just, events in your family's life can be very helpful. And so when we talk about Alzheimer's disease and we talk about all of these things that are going on with our loved ones, such as the, repetitive thoughts and behaviors, agitation, the stress and anxiety that they might be feeling, using reminiscence therapy in this way can really structure different ways for them to both be focused on some of these things that are right there in the immediate with them. And so you can do things like, even like baking, so for example, even smell, right, can elicit a memory for an individual, and allow them to talk about it. So baking cookies together, for example, and getting them talking about, did they ever bake with their mother, or what was their favorite, baking memory. The smell of the cookies, for example, can have that impact on them. Sometimes your loved one might be not focused so much or into all that, but visual things. So the photo album, even having, let me skip ahead here real quick. The memory boxes. So creating a box with your loved one where you put items in that are comforting to them, both gives them that visual aspect, but they can also touch something. So if it's something that's really important to them, maybe it's something that they won, like an award, that they can pull out and touch. I had a colleague several years ago who, with her grandmother and grandfather, she'd made memory boxes. And she didn't know this when she started this journey with them, to find these things as they were getting older to comfort them. But her grandfather had been an award-winning winemaker. So he had won several ribbons for winemaking at the state fair. And so they had the actual ribbons in the box. So he could pull them out. He would tell them the recipes. He could still remember that piece as he was going through some challenges with Alzheimer's disease. He would rattle off some of the ingredients and how you did it every time he saw that ribbon. So that was still there for him. He could still communicate in that piece. He just needed that prompt to be able to talk about it, right? And it was also something he could get out and touch. This is something you can incorporate into the day-to-day piece too, if it's comforting for the individual, and giving them something to hold on to while they're having that conversation as well. And that can look like whatever you want it to look like in terms of the memory box. You can decorate it however you want to. You can put into it whatever you want to. I know some people even put if their loved one went to concerts or shows or something like that, ticket stubs from different things, so they could pull it out and look at it. And again, we don't want to focus so much on the accuracy of the story they're telling us. It's more about that emotion and getting them talking about it and just going with it, whatever they share with you. I mentioned earlier about your loved ones who might be fidgety, who need something to do with their hands. And so memory blankets have been one way for us to figure out how do we do this, and give them something to do. So these are literally blankets that you can make. There are a number of different companies out there that will help make them for you. You tell them, kind of some of the things that you want on them. But you could also make it yourself. They have things like pockets on them so they could put photos that are meaningful to the person, zippers so they can zip and unzip, ribbons so that you could tie and untie them. And a lot of people, the reason we call them memory blankets is because a lot of people will sew printed photos or copies of printed photos for their loved one to look at, of maybe grandchildren or special events. Or in the pockets, you can put little things that are meaningful to that person, so that they can pull that out and discover it and talk about it. So when we talk about reminiscence therapy, it's really anything like this that helps that individual start telling their story. We really want to focus on, again, the emotion piece from that. Even showing a picture from an old magazine has shown to be therapeutic for individuals, like going through old magazines or listening to music that was popular when they were younger. Things like that can get them sharing and telling stories, and can really be calming and very soothing for them. So consider this a tool that you can use with your loved one. You might think about it as an intervention if they are getting agitated, or if you notice they're really struggling that day, to get them, going in terms of that particular piece. Trying to think if there's anything else I wanted to say. Sometimes, I think about this a lot, even though we're a lot of times taking care of our loved ones in this particular program, we might not know everything. They might not have shared us every story, or shared us things that are meaningful to them from when they were much younger, right? And so sometimes even within families, we learn a lot about our loved ones through doing things like reminiscence therapy, things that we had no idea about. And so that can be very helpful in terms of just really strengthening that bond and having that meaningful time with your loved one. Um, it can also help, I think, not just with the stress and anxiety of your loved one, if they're really struggling with that and you're noticing that, it can help us too as caregivers just to have that moment where maybe we're not worried about the meds for a moment, or we're not worried about them falling for a moment. We're really just experiencing that time together. And that can be really meaningful in terms of that engagement piece. I know that with my aunt, we did similar things to this when she was going through Alzheimer's disease, and I still hold on to those moments. Now that she's passed away, it's like 6 years ago, almost 7 years ago now. Really holding on to those moments that we had together, doing different activities like this, even when she was in the throes of the disease. So again, this can be very helpful to us as caregivers as well, not just for our loved ones. All right. And I want to end by just, well, obviously we'll have time for questions and stuff, but I want to end by, really just thinking about the compassionate care piece and, that idea that sometimes it's going to take a little work. Investment and time to figure out why some of the behaviors are happening. But taking that time to really think about those pieces can really help us in the long run and help us with some of the parts of our journey that we're really struggling with. All right. Well, I think we'll open it up for questions. How can I help you all? Does anybody have anything, that you're struggling with that you want to talk through?
I have never experienced taking care of somebody who has dementia or Alzheimer's, so it was really, really good information to hear about the showering and how that could affect them, and
Mhm.
almost like a sensory thing, like autism, maybe a little bit. So it's a different way of thinking about it. So that helps
Mhm.
me understand better what might be so upsetting for them to bathe.
Yeah, yeah, and that's a big one, right?